Respected Chairperson, delegates, and my dear friends. Today I am going to focus within 15 minutes regarding the overview of cancer, although some of the points already has been covered by the first speaker. So when we talk about cancer, we know the incidence of cancer is increasing more and more. And there is an increase of cancer incidence by, if we look at 2020, that will be nearly 50% worldwide is going to increase. And there is a cancer burden in India, usually in males. The common cancers are mouth or oropharynx, esophagus, stomach, lungs, bronchus or trachea. And most frequent cancers in females, we have cervix, breast, mouth or oropharynx or esophagus. Now, so our focus is what is cancer, what causes cancer, is there any link between genes and cancers, how it is diagnosed, and can it be prevented? So we know it's already been covered that cancer is a disease of a genome. It is characterized by uncontrolled, uncoordinated, and undesirable cell division. As it's already been told, that there is a process called apoptosis, that is the programmed cell death. The normal cell division takes place, new cells are formed, and the older cells at programmed stage, they die. But what happens that in cancer, this balance is disrupted, and this disruption will lead to uncontrolled cell growth or loss of a cell's ability to undergo cell suicide or cell apoptosis, which may lead to uncontrolled growth of the cell. What's a neoplasm? That means it's just new growth. It is a mass of tissue which is formed as a result of proliferation of the cell. This proliferation is abnormal, excessive, uncoordinated, autonomous, and it is purposeless. Neoplasm could be of two types, benign or malignant. You can have a look at the picture. It is a benign mole, just a simple mole which can be seen, whereas if it becomes malignant, it forms a melanoma. There are certain main features of difference between benign and malignant, like in terms of their rate of growth. The malignant tumor have a rapid growth, whereas benign tumors have a slow growth. The nature of growth, malignant tumor invades surrounding tissue, whereas benign is localized in the same tissue. Malignant tumor metastasis via the bloodstream and the lymphatic system, whereas benign tumor doesn't spread, and cell differentiation is very poor in malignant, whereas it is nearly normal in case of benign. So it's already being just introduced that what causes cancer. It could be carcinogens are the agent which can bring the changes in the DNA or which can cause the process of carcinogenesis. It could be some of the virus or bacteria, some chemicals or exposure to radiation, hereditary, diet, or pertaining to hormone. The example of a human cancer virus, as all of us know about HPV, that's the cause of the cervical cancer and it's very common. Other viruses which are associated with the human cancer, we have Epstein-Barr virus, which may lead to Burkitt's lymphoma, human papilloma virus, cervical cancer, hepatitis B virus can give rise to liver cancer, human T-cell lymphocytic virus, which can give rise to adult T-cell leukemia, Kaposi sarcoma, which is associated with Kaposi sarcoma, usually associated with HIV virus. Other etiologies, physical agents, that could be UV radiation, ionizing radiation, or any kind of radioactive material exposure. Chemical agents could be tobacco, smoke, aniline dyes, pesticides, asbestos, benzene, and cadmium. And there are certain examples which are given that some industrial chemicals which are linked to cancer, like benzene may give rise to leukemias, ether, lung cancer, asbestos, lung cancer or epithelial lining of the body cavities, nickel, lung, nasal and epithelium cell, and hydrocarbons in soot, tar or smoke may give rise to skin and lung cancer. So we can understand that some of the industrial chemicals or the environmental contamination also may give rise to exposure to carcinogen, which we cannot get rid of. Then another cause of cancer is genetic and familial factors, dietary factors, unhealthy lifestyle, more intake of a fat, alcohol, smoked meat, food containing nitrates, high calorie intake, as well as obesity is at higher risk of developing cancer. Hormonal agents could be oral contraceptives, prolonged estrogen replacement therapy, or hormonal imbalance. Other factors which may lead to cancer is breakdown in the immunity, As we know, if we are healthy enough, our immune system can target and it can destroy any kind of bacteria or virus, or it can destroy our cancer cells. But once our immunity is low, again the cells are not destroyed, which may give rise to a cause of a cancer. So risk of cancer increases with the age. It can increase when the immune system is low. It could be of any disease like HIV infection, which may give rise to Kaposi sarcoma. Immunosuppressant drugs, like maybe any previous treatment of the immunosuppressant drugs are taken by the patients, anxiety and depression. Coming to the various forms of cancer, there are different types of cancers like carcinomas, sarcomas, lymphomas and leukemias are the commonest one. Carcinomas are the one when the cells arises from external and internal body surfaces, like examples are lung cancer, breast cancer and the colon cancer. Sarcomas are the cancers which arises from supporting tissue of the body like bone, cartilage, fat, connective tissue and the muscle. Lymphoma arises in the lymph nodes and the tissue of the immune system, whereas leukemia are the cancer of the immature blood cells which grow in the bone marrow and tend to accumulate in the bloodstream. How the cancers are named? They named based on the point of location. So from where it originates, if it originates from the gland, it is known as adeno. If it originates from the cartilage, it's chondro. If it's arises from RBCs, then it is erythro. So based on that, the cancer can be named. Now, when we talk about cells proliferation, it does not take like within a minute, or it takes time to recover. So if you look at the picture, the healthy cells, there is a normal cell alignment and there is a cell development, the cell growth is taking place. Whereas if it is a hyperplasia, the hyperplasia is showing that the number of cells are increasing in number, whereas the shape does not vary. Whereas if it is a carcinoma in situ, the shape also vary and it may lead to invasive cancer further. Cancer is a genetic disease that develops in a sequence of steps. Carcinogenesis is the process. It is the transformation of normal cell into cancerous cell, and it takes step by step for the transformation of a cancer. There are certain steps takes place when we talk about carcinogenesis, like you have initiation, promotion, malignant conversion, and then progression. So what happens in the initiation? The carcinogen damages the DNA. There will be changes in the structure and the function of the cell at genetic and molecular level. At the stage of promotion, additional assault to cell will take place. There will be genetic damage in the cell, malignant conversion, and then progression of the cells. There will be increased number of the malignant cell, which may lead to cancer. So there are possible triggers, carcinogens, which will initiate the growth of the abnormal cell and which may give rise to increased number of cells, which may give rise to invasive cancers. There are different types of cancer genes. Basically, there are three types of cancer genes which are important. One is the oncogene. Oncogene, the function is normal function is promote division, whereas the mutated function, it promote division of the abnormal cell, which we do not want. Then you have tumor suppressor gene. As the name suggests, tumor suppress, that means it suppresses the cell division, whereas in a mutated function, it fails to suppress the division. That is why the abnormal growth takes place. Then you have DNA repair gene mutation, which repair the DNA mutation, whereas in mutated function, in case of cancer, it fails to repair DNA mutation. That's how the enzymes mismatch and the excision repair takes place. When we say mutation, what is mutation? Mutation means change in the DNA sequence, which can be inherited from either parent. Another type of mutation is somatic mutation. That means there will be change in the DNA sequence in cells other than the sperm or egg, and the mutation is present in the cancer cell, its offspring, but it is not in the patient's healthy cell. If we talk about mutations and the cancer genes, mutations in the cancer genes can be both somatically or it can be inherited. If it is inherited from the parents, which is present in every cell of the body, those people are higher at the risk of developing cancer. Whereas if it is a somatic mutation, which can occur at any cell of the body except the germ cell, and therefore they are not passed to the children. This picture shows that if the mutation inactivate, so that inactivate the tumor suppressor genes, cells will further proliferate. Mutation will inactivate again the DNA repair genes. Again, the mutation of proto-oncogenes will convert into oncogenes and give rise to production of the carcinogenesis, and then mutation inactivate several more tumor suppression gels, which leads to further cancer. The example which is already being communicated to you, like the example is BRCA1 mutation and BRCA2 mutation, which is the commonest example for the breast cancer. Then you have germ-like mutation, that is RB protein, which may lead to retinoblastoma, as well as 80% of the small lung cancers will have RB proteins. Then mutations of P53, 50 to 75% of all the cancers will have P53 mutations. When we say invasion and metastasis, it is done by spread, like it spreads by cancer cells. They invade the surrounding tissue and the blood vessels. Then they transport it by the circulatory system to the distant sites, and then they re-invade and grow into the new location. This is how the metastasis takes place. Early cancer may not have any symptoms. So when we talk about symptoms, sometimes it happens that when you come to know about the symptom, it's a very late stage. So the general common symptoms of a cancer would be fatigue, unexplained weight loss, fever, pain, skin changes, or changes in the bowel and bladder function, which is usually, these are the simple symptoms which usually are neglected by the patients. Depending on the sites, again the silent symptoms may change. If it is a brain cancer, it could be headache, seizures, vertigo. If it is a respiratory, it could be cough, hemoptysis. So depending upon whichever side is affected, the symptoms may change. There is a word called caution, which particularly give rise to that if anybody has these particular risk, or if there is anybody who is having these factors, should contact to the physician to identify the further cause of the disorder, like a sore which does not heal, unusual bleeding or discharge from any part of the body, lump or thickening on any part of the body, indigestion or dysphagia, changes in the wart or mole, or persistent cough or hoarseness. How do you diagnose cancer? Based on the history, physical examination, clinical manifestation, and then you also have to do a complete diagnostic evaluation. Diagnostic evaluation could be done with the help of various X-rays, CT scan, MRI, PET scan, ultrasound, or the main diagnosis need to be confirmed with the help of biopsies. Then there is something called tumor markers. Tumor markers are the chemicals which are present in the blood. It is produced with the certain cancers. The examples are AFP, that is alpha-fetoprotein, which is present in cases of lung cancer, pancreatic, colon, and gastric cancer. CA125, which is present in ovarian and pancreatic cancer. Estrogen receptor, that is in breast cancer. HCG, that is usually common in GCT germ cell tumor or choriocarcinoma. Prostate surface antigen, which is in the prostate cancer. CA19-9 for pancreatic and colon cancer, and CA15-3, that is for the breast cancer. So if anybody is having exposure to these chemicals in the blood, that means that may give rise to a particular disease. How do you stage a cancer? Usually it is done with the help of the TNM staging. T stands for tumor, N stands for lymph node, M stands for metastasis. And based on this staging, from Tx to T4, the staging can be categorized. Like Tx means the tumor is not evaluated, T0 means there is no evidence of a tumor, whereas TIS means carcinoma in situ, and T1 to T4, the number of the growth of the tumor or the size of the tumor is increasing, and based on that it is decided that which stage it is. N stands for lymph node. NX means there's nearby lymph nodes cannot be evaluated, whereas N0 means there is no evidence of lymph node, whereas N1 to N3, which indicates that spreading of the lymph node, the higher rate the number, the more of the status of the lymph node can be evaluated. M stands for metastasis. If MX means it cannot be evaluated, M0 means no evidence, whereas M1 means there is a distant metastasis which is present in the patient. Grading of the cancer can be done based on the grade 0, that means the carcinoma in situ. Stage 1 means cancers are localized to one part of the body. Stage 2 means it's locally advanced. Stage 3 is also locally advanced, whereas stage 4 means they have often metastasized or spread to the other organ throughout the body. How do you manage? The treatment of the cancer we are aware of. surgery, radiation therapy, chemotherapy, bone marrow transplant, biologic response modifier therapy, and gene therapy. Now, as we know that the cancer is a genomic disease, so nowadays we have human genome projects which are going on, and gene therapy is basically it is the insertion of the functional gene into the cells of the parent to correct any inborn error of the metabolism or to alter or to repair the acquired genetic abnormality. The example is given that if there is a loss of tumor suppressor genes and overexpression of the oncogenes that has been identified in number of malignancy, this abnormality can be corrected like P53 by inserting a copy of a wild type gene. So that can be inserted and that abnormality can be corrected, and with the help of that the disease can be cured. Then coming to the preventive part of it, as per the health promotion, your goal is to prevent cancer, to detect it early and in its most treatable stage. So when we talk about prevention, it takes place in three places: primary prevention, secondary and the tertiary. Primary prevention is the disease has not occurred, so we are taking some protective measures like not using tobacco, choosing food with less fat and eating more green vegetables, fruits and whole grains, exercising regularly and maintaining a lean weight, avoiding the harmful rays of the sun, using sunscreen and wearing clothing that protects the skin. Whereas secondary prevention, already the disease has occurred. So you have early detection and screening takes place to facilitate the early detection, and with the help of that early detection, the early treatment can be provided to the patient. Now when we talk about screening, there are certain screening which is already being planned that which can be done. For example, for the breast cancer, breast self-examination can be done at the baseline every 1 to 2, every month at one particular day can be performed. Or for the case of the cervical cancer, pap smear testing can be done at the age of the 18 or at the age of the woman who is sexually active. Or colon or the rectal, digital rectal examination usually can be done every yearly. Tertiary prevention means it's the limitation of disability and rehabilitation. So to conclude, we know that the cancer is a disease of genome. Most of the tumor harbor a constellation of a structural genomic alteration that may dictate their clinical behavior and the treatment response. So if we have a knowledge of a particular genome, then based on that, based on genes, it can be treated with the help of gene therapy. And there are various human genome projects which are going on, which identify that which are the newer genes which are coming up, which are developing cancer, so that it can be treated in advance. So with this, I conclude the topic.
Thank you, Aditi.